Skin to skin is something that we encourage all parents to do with the babies, particularly mums at delivery. The reason why we encourage skin to skin is because it does distress babies, it keeps them warm after delivery, and it also regulates the heart rate and the breathing, and babies are a lot more settled when they're on mum's chest. And also there's lots of benefits to dads doing skin to skin. It helps them to bond with the baby, and it helps to settle babies with mum or dad.
It's very important for grandparents, friends and especially dads and partners to actually support the mother while breastfeeding. The dads can do lots of things, help do the cooking, supply drinks, be there, and especially as well dads need to have skin-to-skin contact as well, so it's good for them to actually learn how to hold babies and have skin-to-skin contacts. The friends can help by cooking and taking dogs for a walk and other care of our children, especially with grandparents as well. If you're lucky enough to have grandparents, it's a good idea that they can help with the housework and the caring of other siblings within the family. If dads want to get in contact with me, they can contact me through Redhouse Children's Centre, where they can pass on a message, and they can also contact Shirley and Health Visitor, which then can contact the children's centres to get hold of me, and I'm easy to talk to and available for whatever somebody wants like.
I became a volunteer peer supporter just over 2 years ago when I had my little girl Georgie. I struggled with breastfeeding in the early days and managed to get to grips with it, and I breastfed for 14.5 months and wanted to help other women achieve their breastfeeding goals. And what we do is we try and see every breastfeeding woman in the first few hours of them giving birth so that we can help them with latching, attachment, so they're comfortable with things like that.
You can start off when you go to antenatal breastfeeding classes, where they'll give you the numbers and you need to contact any peer support. When you're on the maternity wards, in your discharge pack you'll get the numbers that you need. The Sure Start centres, there'll always be a group on where you can go and speak to a peer supporter.
We also follow the women up, so we call them 48 hours after discharge, 1 week, 2 weeks, 4 weeks and 6 weeks, or as long as they want that care to carry on.
We can talk to mums antenatally at breastfeeding workshops before they obviously have the baby, and it gives them more information and knowledge about how to successfully breastfeed, sort of going forward. And it's just mum-to-mum support, they're helping each other basically.
Well, breastfeeding is recommended because it has lots of benefits to mother and baby, short-term and long-term. There's lots of benefits to the child's health from the early days into later childhood. It helps prevent the risk or reduce the risk of infection and disease to the child, and for mum it can do the same as well. Yeah. Well, breast milk is very different to formula milk, and I think that's where a lot of mums and families get mixed up. They think they're just the same. They're not. Breast milk is more than just a food. It contains lots of other factors, immunological factors, which help prevent the risk of infection and disease to the baby and to mum as well. There's loads of evidence out there about a lot of infection and disease that it helps reduce the risk of. But just as an example, gastroenteritis, which is your stomach bugs, there's less of an incidence in that in children that are breastfed. Infections like ear infections in the child, chest infections, urinary infections, that sort of thing. There's also evidence linking a lesser incidence of obesity in the breastfed child, and for mum as well. There's a lot of evidence around it reduces the risk of certain cancers, for example breast cancer, ovarian cancer. It also helps reduce the risk of osteoporosis, which is bone thinning disease, and also it can help mum get back to a pre-pregnancy figure, so it helps with that sort of thing as well.
Paid peer support is a new role that's just come in the last couple of months, but before that we've got a strong team of close women that are volunteers that have all breastfed their own children successfully and maybe come across lumps and bumps along the way, so that they can work closely with women in the community as well. So we have different groups like the one we're at today, where mums can come for support and advice, or even just a cup of tea, and to know that somebody's going through the same thing as them. We also have a volunteer peer support phone that I used to hold that women can contact between the hours of 8 and 8 as well. So if they need support first thing in the morning, last thing at night, there's somebody on the other end of the phone that they can relate to.
I find that since I've been doing this role, it's just 2 years now, that if they get the help before they have the baby, and they get that continued support when they have the baby and then when they go home, and they keep in touch with us. I feel that it is working successfully at the moment, yeah.
There is a lot of evidence to show that breastfeeding helps give baby the best start in life. There are lots of benefits to both mother and baby, and that is why the Department of Health recommends exclusive breastfeeding for the first 6 months of life.
Hi, I'm Victoria and I'm a peer supporter at Scartho Children's Centre. I've been a peer supporter for 3 years now and I breastfed all 3 of my children. The first thing you need to do when you're going to start breastfeeding is make yourself comfortable. If you sat on a sofa, you may need some pillows. You could put your feet up on the coffee table, just however you're comfortable, because you may be feeding for quite a while. Now, I'd just like to talk briefly about different breast shapes and nipples, where they're situated on the lady. If a lady has quite small, high up breasts, the positioning of the baby will be quite high, quite tucked under. So the baby's going on like this. If a lady's breast is lower and down here, the baby will be further down and like this. Now, it's really important that you get the positioning right, because if you're just a couple of centimetres either way, you may get sore and the baby won't get the optimum amount of milk. But we're going to show you positioning next. So, positioning. First of all, you need to lead with this hand. The legs may be well under your arms, so use this arm to tuck the bottom well in and keep the baby nice and close to you. Get the baby in a nice straight line and use this arm. Put your hands on the back of the shoulders like this. You may use a finger if you want to, but never push the baby's head on, because this can make a baby kick back and not want to breastfeed at all. So the baby's nice and in line. This arm, you can either put it under there, or if you feel like it, you can put it under there. It just depends on how you feel. So with the baby in line, make sure the baby's nose is in line with the nipple. What we mean by this is, if the nipple's here, the baby's nose needs to be opposite the nipple. If the nipple's here, the baby's nose needs to be opposite the nipple this way. Or if the nipple's here, the baby's nose needs to be opposite the nipple this way. So, baby tucked in, legs under, arms straight. Wait for a wide mouth and then bring the baby swiftly on to the nipple. You can use this arm as well to support the baby, and once you feel the baby doing a few sucks, you can relax a bit. And then when the baby's sucking well in a rhythmic action with pauses, you may relax a bit more. Breastfeeding should never hurt. If it does, seek help immediately, either from your midwife, a health visitor, or a peer supporter at a children's centre. We'll always be happy to help.